Did you know your feet can reveal serious health issues? Our bodies send signals when something's wrong, and feet are often the first to show it. We tend to ignore our feet until they hurt, but symptoms like numbness, persistent cold, or slow-healing sores can be early warnings. Today, we'll uncover 10 warning signs in your feet that could indicate major health problems. By the end, you'll know how to check your feet and what to look for. Let's get started. Let's start with cold feet. Not the nervous kind, the kind you get before a big presentation or a first date. We're talking about a different kind of cold feet here, but a persistent chill that doesn't go away, no matter how many pairs of socks you put on, or how much you rub them. A coldness that seems to originate from deep within, lingering despite your best efforts to warm up. This isn't just a temporary discomfort. It's a signal your body might be sending. This can signal poor circulation, the lifeblood of your body, struggling to reach your extremities. When blood flow is compromised, your feet are often the first to feel the chill. Often from narrowed arteries, a condition where the vessels that carry blood become constricted, limiting the amount of oxygen and nutrients reaching your feet. This narrowing can be caused by a buildup of plaque, a process known as atherosclerosis, or peripheral artery disease, also known as PAD, a common circulatory problem in which narrowed arteries reduce blood flow to your limbs. PAD can lead to not only cold feet, but also pain, numbness, and even more serious complications if left untreated. It might also point to an underactive thyroid, a condition called hypothyroidism, where your thyroid gland doesn't produce enough thyroid hormone, which slows metabolism and reduces heat production. Think of your metabolism as your body's engine. When it's running slow, it generates less heat, leading to cold extremities like your feet. The thyroid plays a crucial role in regulating body temperature, so an imbalance can have noticeable effects. If your feet are always cold, especially with color changes, or in warm environments, if they turn pale, blue, or even red, despite being indoors and adequately dressed, it's a cause for concern. Don't ignore it. Dismissing persistent cold feet as just a quirk could mean overlooking a potentially serious underlying health issue. Persistent coldness is a sign to see your doctor. A simple checkup can help determine the cause and rule out any serious conditions. Early detection and treatment are key to managing these issues effectively. Your feet could be warning you about your heart, as poor circulation is often linked to cardiovascular problems. Healthy blood flow is essential for overall well-being, and cold feet can be an early indicator of potential heart issues or thyroid health. Don't let cold feet be a mystery. Listen to your body and seek professional medical advice. Ever feel constant numbness or tingling in your feet? That's not normal. Persistent pins and needles can mean nerve damage, often from diabetes or poor circulation. Other causes include vitamin deficiencies, autoimmune diseases, or kidney issues. This early warning sign can help catch diabetes or other conditions before they worsen. Don't wait it out. See a doctor if numbness or tingling persists. Your nerves are sending a clear message. Listen to your feet. Swelling, or edema, in your feet can be more than just a cosmetic concern. It's a sign that something might be amiss within your body. We often dismiss it as a result of a long day or uncomfortable shoes, but persistent swelling warrants a closer look. While it's true that swelling isn't always serious and can result from standing too long, especially if you have a job that requires you to be on your feet for extended periods, it's crucial to differentiate between temporary discomfort and a potentially underlying health issue. Persistent, unexplained swelling can signal a deeper problem within your body, and it's important to pay attention to these subtle cues. Don't ignore changes in your body, especially when they persist over time. One potential cause is heart failure, where the heart struggles to pump blood efficiently, leading to fluid buildup in the lower extremities. Kidney problems can also manifest as swelling, as the kidneys play a vital role in regulating fluid balance in the body. When they're not functioning correctly, fluid can accumulate. or vein issues, such as venous insufficiency, where the veins in your legs have difficulty returning blood to the heart, causing blood to pool and resulting in swelling. If your shoes feel tight all of a sudden, even your most comfortable pair, it's a sign that your feet might be experiencing some degree of swelling. Or you see pitting and indentation when pressed, where pressing on the swollen area leaves a visible dimple. It's a strong indicator of fluid retention. If you notice these signs, take it seriously. Don't brush it off as a minor inconvenience. Swelling often means your body is struggling to manage fluids effectively. It's a sign that the delicate balance of fluid regulation is disrupted. If it's ongoing, especially with shortness of breath, which could indicate fluid buildup in the lungs, it's even more critical to seek medical attention. Or urination changes, such as decreased frequency or difficulty urinating, it could point to kidney-related issues that need to be addressed promptly. In such cases, seek medical help without delay. A healthcare professional can properly evaluate your condition and determine the underlying cause of the swelling. Don't ignore swelling. It's a major red flag that your body is waving. It's a signal that something isn't quite right and needs investigation. Your feet could be showing signs of underlying health problems that you might not be aware of. They can act as an early warning system, specifically of heart or kidney trouble, both of which can have serious consequences if left untreated. Early detection and intervention are key to managing these conditions effectively. Changes in foot color are important signals. Blue or purple feet mean poor oxygen delivery, possibly from circulation or heart issues. Persistent redness could be infection, gout, or a diabetes complication. White, blue, then red color changes may signal Raynaud's phenomenon or autoimmune disease. Your feet shouldn't be a rainbow. Lasting discoloration needs a doctor's attention. Know you're normal and act on any changes. Color is your body's warning system. Sores or cuts on your feet, those seemingly minor injuries we often overlook, can sometimes become a cause for serious concern. When these wounds linger, stubbornly refusing to heal despite our best efforts, it's a serious warning sign that something more profound might be at play within your body. It's your body's way of waving a red flag, urging you to pay attention. Diabetes is a top cause, often lurking beneath the surface as the primary culprit behind these persistent sores. Nerve damage, also known as neuropathy, means you might not even feel the initial injuries, allowing them to worsen unnoticed. And poor circulation, a common companion to diabetes, slows the healing process dramatically, hindering the body's natural ability to repair itself. These seemingly small sores can quickly worsen, escalating from a minor inconvenience to a major health crisis in a surprisingly short amount of time. This can lead to infection, as the compromised skin becomes an easy entry point for harmful bacteria and other pathogens. In the most severe cases, if ignored or left untreated, these infections can progress to a point where amputation becomes the only viable option. Other causes include severe circulation problems, stemming from underlying vascular conditions that restrict blood flow to the extremities. One such condition is advanced peripheral artery disease, where narrowed or blocked arteries impede the delivery of oxygen and nutrients to the feet. If a sore isn't showing any signs of improving after a week, despite diligent care and attention, or if you notice any signs of infection, such as increased pain, redness, swelling, or pus, it's crucial to see a doctor immediately. Non-healing wounds, especially on the feet, are a medical emergency that requires prompt evaluation and treatment to prevent potentially devastating consequences. Don't wait. Your feet are telling you something urgent, a message that demands immediate attention and should not be ignored. Toenails can reveal more than you think. Thick, discolored nails often mean fungal infection, but can also signal poor circulation or immune issues. Pitting or thickening may point to psoriasis or autoimmune disease. Spoon-shaped nails can mean iron deficiency. Dark streaks could be melanoma. Don't just cover up changes, get them checked. Your toenails are windows into your health. Pay attention to what they're telling you. Chronic foot pain isn't just from aging or overuse. Arthritis, especially osteoarthritis or rheumatoid arthritis, can cause persistent pain and stiffness. Nerve issues like neuropathy or Morton's neuroma can cause burning or stabbing pain. Stress fractures or osteoporosis can also be culprits. If pain persists despite rest and good shoes, see a doctor. Don't ignore ongoing pain. Find the cause. Your feet shouldn't hurt all the time. Occasional foot odor is normal, but persistent. Strong smells aren't. Chronic odor can mean fungal infection or bacterial infection, or excessive sweating. Sometimes a sweet or rotten smell signals an infected ulcer, especially in diabetes. If odor doesn't improve with hygiene, get checked for infection or underlying issues. Don't ignore unusual smells. They can be your first clue. Your feet's scent can reveal hidden problems. Frequent foot cramps or spasms aren't just annoying. They're signals. They can mean dehydration, low electrolytes, or circulation problems, like peripheral artery disease. Night cramps may point to sluggish blood flow or nerve issues. Thyroid or kidney disease can also play a role. Occasional cramps are normal, but frequent ones need attention. Check your hydration and minerals, but see a doctor if cramps persist. Your muscles are asking for help. Sudden changes in foot shape, like falling arches or curling toes, are serious. Adult-acquired flat foot often means tendon damage or inflammation. Hammer toes or claw toes can signal nerve problems, especially in diabetes. Severe deformity, like Charcot foot, is a medical emergency. Don't ignore rapid changes. Get checked right away. Structural changes are your body's alarm bell. Your foot's shape matters. Those are 10 critical warning signs your feet can reveal. Early recognition can help catch diabetes, heart disease, or nerve issues before they escalate. Make foot checks a habit. Your body is always communicating. If you notice persistent symptoms, talk to your doctor for proper diagnosis. Don't self-diagnose or ignore the signs. Your feet deserve attention and care. Stay healthy, and keep listening to what your feet are telling you.